Hello, my name is Andrea Guillen. The topic is renal complications of hematopoietic-cell transplantation. Definition: hematopoietic cell transplantation is the infusion of progenitor cells to restore spinal cord and immune functions in patients with acquired and genetic malignant and non-malignant hematopoiesis. Acute kidney injury after transplantation has initially defined as a doubling of the baseline serum creatinine level within the first 100 days after transplantation. Applications in medicine. The initial evaluation of a patient who has undergone a hematopoietic cell transplant and has an elevated creatinine level should focus on determining the cause of the increase. It is important to obtain a complete urinalysis, the urinary albumin-creatinine ratio, a complete blood count with evaluation of the blood smear and the serum levels of lactated dehydrogenase, aldoglobin, and calcineurin inhibitors.
First of its kind treatment is offering kidney failure patients with a rare disorder some new hope. Mary Nichols introduces us to a Utah man who is the first in the world to use this treatment to fight MGRS.
I got sick.
Larry Liu and his wife were on an LDS mission when his health took a turn.
I went to the emergency room and they found out my kidneys were not functioning at all.
After a year and a half on dialysis, Larry received a kidney transplant from his brother.
It was pretty good for the first few months. All my labs were fairly normal for somebody that had just received a transplant.
But then his new kidney started to fail.
6 months into his transplant, we found that his kidney function was worsening and he had protein in his urine.
A kidney biopsy revealed Larry had a rare disorder.
We have this condition called monoclonal gammopathy of renal significance.
Known as MGRS, this disorder means plasma cell clones were in Larry's bone marrow. These clones produce proteins that attack the kidneys.
They had to kind of experiment with different therapies to see what would work to get rid of that excess protein.
None of the conventional therapies worked, but then Larry tried a drug that's typically used to treat a different disease.
And with 7 doses, his protein in the urine almost became close to 0 from 10 grams. And his kidney function has dramatically improved.
7 months later, Larry says he's feeling great.
Right now I'm able to function. I can do normal things. I'm even working in the yard.
Mary Nichols for Check Your Health.
Pros and cons. Pros: overall improvement in outcomes after hematopoietic cell transplantation. It is a great cure for lymphomatopoiesis due to its effectiveness. Cons: kidney injury remains a common complication and contributes to the morbidity and mortality associated with the procedure. Risk factors that are unique to patients who have undergone hematopoietic cell transplantation include acute GVHD, hepatic sinusoidal obstruction syndrome, use of calcineurin inhibitors, and viral infections.
One of the improvements I can see right now immediately is there's better coloration in my face in just a few days. As far as the kidney function, I won't know until the cells do their work for a month or 2 to 3 months. But I've seen coloration and I feel good. Well, I haven't had no treatments before I come here. I went to the VA, I go to the VA medical, I'm a veteran. And they told me that my kidneys were down to 29%. And in 5-10 years, I might have to go on dialysis. So I thought I got to do something about it. And I asked the doctor there, I said, what about stem cells? She didn't know too much. She says, when the time comes, we'll look at putting you on dialysis and put you on a list for a kidney. And I didn't want that. I heard a little bit about it. I researched on the internet about it. And then I started calling. I called a few places here, in Thailand, and then I got a hold of Faith and went through the internet, and she let me talk to the doctor. I talked to a couple other doctors, but when I talked to the doctor here, I can't remember his name, I'm bad at names, but he seemed very intelligent, and I'm a pretty good judge of character, and he knew what he was talking about, so I felt comfortable. This facility is phenomenal. They keep it clean. There's plenty of staff. The rooms are nice. I don't have no complaints. If I have, there's more personal care. You know what I'm saying? More personal care. So if I had something major wrong with me, I'd rather come over here and have that problem taken care of than go to a local hospital back home where you're just another number. Everybody was professional. Everybody did a good job. So I have no complaints at all there. I tell them to get a hold of and talk to Dr. Nassar. Talk to him, let him know. I had to send my blood work. I had to send everything over here before, and he studied it. And he can study your condition. And when you're spending money on yourself, you're never wasting it. Because if you let your condition go, you can't take nothing with you. It was a positive experience.
Remission of blood in Ecuador. In Ecuador, this type of transplant, but how health kidney failure is performed in this case. The incidence of acute kidney injury ranges from 10% among autologous transplant recipients to nearly 50% among patients receiving allogeneic transplants.
That's another important issue because we know now that renal complications are very frequent in the patient that receive a bone marrow transplantation. We can say that probably allogeneic bone marrow transplantation is a cause of chronic kidney disease. And in this study, we were able to test the hypothesis talking about the frequency of acute kidney injury in this context and the frequency of chronic kidney disease in this context. In our study, unfortunately, we don't have a link between acute kidney injury and chronic kidney disease, probably because patients that have very severe acute kidney injury have terrible prognosis, and many of them didn't survive. But an important conclusion of our study was that patients without any alteration in renal function before transplantation had or present during the evolution of the transplantation chronic kidney disease. And of course, this is a group of very, very, very young patients. And this is a very complicated, accurate complications and accumulate morbidity for those patients. So this is important conclusion. We need to work and try to predict the risk of chronic kidney disease before transplantations in order to avoid complications and improve survival in these patients.
In conclusion, current evidence suggests the need to rethink the cause of acute and chronic kidney injury in patients after hematopoietic-cell transplantation. Most of these kidney lesions are related to total body irradiation of treatment with calcineurin. Thanks.